Save people's lives and at one time help people with polio walk again. Now the hyperbaric chamber is helping treat dozens of other illnesses. Dr. Joe shows us the amazing results coming up next.
Doctors used a hyperbaric chamber to save a woman poisoned by carbon monoxide. It was a very sad story. 2 of her children had died.
A hyperbaric chamber looks like something from outer space, actually, and Bay Area doctors are using it for all kinds of medical problems. Dr. Joe is here now with the story. Joe?
Thanks, Denise. Hyperbaric chambers are insurance approved for 14 different ailments. The big question, can they offer even more benefits? Tonight, one stroke patient who says these treatments are giving her more than new hope.
Look inside these glass cylinders. These are hyperbaric chambers, delivering high-pressure oxygen, helping dying tissue regain its blood supply.
You cause very small vessels to go back into an area where there's living tissue but not getting adequate perfusion.
Dr. Alan Spiegel is a neurologist. He uses the chambers to treat wounds, infections, burns. He also treats several unapproved conditions like autism, nerve damage, and stroke.
The people who I generally treat actually are people who are well beyond those who you would normally expect to improve.
Many have no cure.
And unfortunately, I am the area of last resort.
I couldn't move my legs or my arm at all.
Joan Brennick's stroke left her paralyzed and in a wheelchair. After one hyperbaric session, she noticed a change.
I moved this leg onto this leg and took my sneaker off, which was something I couldn't even dream about doing before.
I was actually a little bit of a skeptic.
Joan's husband Michael had doubts. Then he saw a difference.
I was just dumbfounded. I couldn't believe it.
But one reason why more people don't get hyperbaric therapy for stroke, it's not covered by insurance.
The Brennicks are convinced oxygen therapy got Joan back on her feet.
Within a week's time, she was up walking around with assistants in the house.
They want other stroke victims to know it's an option.
It takes everything I have to contain myself not to get up out of my seat and tell everyone I see in wheelchairs and walkers to try it, because it's helped me so much.
Dr. Spiegel says other countries routinely use hyperbaric therapy for many other conditions, including MS and brain trauma. He believes there's enough scientific evidence to support its use in this country as well. If you want more information, log on to our website at myfoxtampabay.com. Click on Seen on TV. Denise, Kathy?
Thank you so much, Dr. Joe. Really bad news for your lawn.
Photographs show 46 years of John Worm's life when he became a husband and a father. A loving family who had no idea what was to come. March 1st, 2007.
They basically told me that if he makes it through the night, it'll be a miracle.
Earlier that day, John went fishing with his brother-in-law. A relaxing day at sea quickly grew tense.
Never in my wildest dreams did I imagine it could be a stroke.
While John was in ICU, his wife Maggie was told his stroke was just as fatal as a gunshot to the head at close range.
One of the doctors told me that if he lived, that he would never move again. When he walked out of the room, I was just in shock. I couldn't even imagine. And I was looking at him, and John just started moving his foot, as if to say, he doesn't know what he's talking about, he's wrong.
While sitting by John's side in the hospital, Maggie searched the internet. A website for hyperbaric oxygen therapy caught her eye.
Keep up the fight, honey. Okay?
Within a few days after John's stroke, Maggie signed him up for treatment. On his first day, something remarkable happened. He moved his leg.
The way he's got his legs held right now, exactly how he always slept at home. He didn't start doing that until he started getting the oxygen treatment. His body is returning, I think, to more of a normal state.
Pressurized chambers are commonly used for sports medicine, wound care, and the bends. It works by pushing 100% oxygen into the bloodstream, stimulating new blood vessels to grow, helping the body heal faster.
How do you know it works? It's like seeing is believing. You can see it. You can see it working.
In June, 4 months after his stroke, John was on his 31st treatment, a critical point in his rehab, since the best chance for recovery usually happens in the first 12 months.
Hey, John? John, are you going to open your eyes? A big yawn. Did you have a good nap?
When John is awake, he seems to be aware of what's going on around him, especially his wife, who's always by his side, holding on to hope.
There we go.
Jupiter neurologist Linda Powell has prescribed oxygen therapy before with little results, but she agrees it can be helpful for certain patients.
I think that when you're left with not much alternatives or options, it's a viable option. Potentially, the hope is to bring more circulation to an area of tissue that's damaged. The problem is that if it's damaged and is salvageable, the hyperbaric chamber will probably help. But if it's damaged and it's dead and it's no longer going to regenerate, the hyperbaric chamber is not going to help.
Marco! While some skepticism surrounds oxygen therapy, many families like the Badillos put their faith in the chamber.
Your kid is in there and he's got a brain and you know it. You just can't. You're trying to get him out.
Marco was diagnosed with autism at age 3. Teresa, Marco's mother, saw his moods change in a blink. Sometimes he was out of control and defiant. Other times he was aloof, his stare blank.
You couldn't take your eyes off of him for 1 second.
Marco, do this.
Back in the 90s, behavioral therapy was one of few options. Marco showed improvement, but not enough for his mother.
They told me that if he didn't talk by 5, there's no way he'd talk.
Teresa threw herself into autism research and made a discovery. Some of her son's behavior could be linked to an overgrowth of yeast, and bacteria and fungus cannot survive in a 100% oxygen environment.
I just had this thing that I knew this hyperbaric was going to do amazing things for him.
Her motherly instincts were right, and on the 9th treatment at age 7, Marco made a breakthrough. He spoke.
Marco, what are you doing?
I am
painting.
Paint.
Marco has grown, just like his vocabulary. The solitary little boy is now a smiling 16-year-old.
You really have to believe that there's options and there's doors to open.
At Maggie's house, those doors opened just enough to finally bring John home.
My youngest one will pick up his arm and put it around him, and he just feels perfect and he feels safe in Daddy's arms still.
Maybe John can feel life going on around him. And if or when he opens his eyes for good, his family will be there, waiting.
Come on.
Nice high steps with that right foot, tucking that toe towards the ceiling. That was very good. Do that one more time. Excellent. Every step like that, Mr. Greenwald. Focus now. Focus. Nice high right foot. Very well done.
Okay, the opposite.
August 9th will mark the one-year anniversary of a very dark day for a Michiana family. That's when their young, athletic wife and mother had a massive stroke that she miraculously survived, but was left with lasting disabilities. Julie McNamee of Mishawaka spent weeks in the hospital in outpatient rehab, and while she made huge strides, her improvement hit a wall. That's when she and her family decided to look into a treatment not yet approved by the FDA for stroke patients, but is showing promise. It's called hyperbaric oxygen therapy. Maureen met up with Julie and Mark to see whether this controversial treatment gave them the hope that they were looking for.
We first introduced you to Julie and Mark McNamee of Mishawaka in May. After suffering a massive stroke on August 9th of 2010 at just 47 years old, Julie had come a long way in 9 months, but still had some paralysis on her left side and needed the use of a wheelchair or cane and had seizures.
You know, I had a very significant stroke and the whole entire left side of my body was paralyzed. So I did have some improvement before the dives started. My eye was droopy and my mouth was drooling.
In May, they traveled to Rockford, Illinois, to the Rockford Hyperbaric Healing Center. We asked our sister station there to shoot Julie's treatment. While Julie is literally fed into an oxygen chamber, they call each session a dive. President Joe Sharp says they see varying improvements depending on the patient.
Because we see anything from just subtle improvements in quality of life to just miraculous things. We've had people start talking that couldn't talk within 3 or 4 days of the treatment. So for most people, though, it's a very gradual process.
Hyperbaric oxygen therapy involves breathing pure oxygen in a pressurized room and is most commonly used to treat infections and wounds that won't heal. But Sharp says more studies are underway involving its use for stroke patients.
Once that oxygen gets in there, it turns back on those cells, makes them work efficiently. They start communicating with the body again.
Since hyperbaric therapy is not being used for strokes in our area, the McNamees decided to pay for 40 dives every other day at a total cost of $7,000. And while that may sound like a lot of out-of-pocket, when hyperbaric is covered by insurance for approved use for treating wounds, hospitals often get $2,000 per dive. With 40 dives now over, I met with Julie and Mark again in their Mishawaka home.
I think there definitely was some improvement. My walking is better.
Was there some improvement you were looking for that didn't quite happen yet?
Mm-hmm. My left arm is still paralyzed. Now, it does have quite a bit of tingling in it, which is how the movement of my legs started.
With 2 daughters in college and 2 sons at St. Joe High, Julie and Mark say the hardest part of the treatment was having to leave town. Julie says the treatment itself was a breeze.
It's definitely an easy treatment. It's jumping into or being pushed on a gurney into the tank. They close the door, it's like a submarine door, and it's watching TV or listening to music.
And Julie, who has a special exercise bike for rehab, says she has more strength and had ridden her stationary wheels 25 miles the day before our interview. Mark says in addition to Julie's strength, they also believe hyperbaric therapy may have stopped his wife's seizures.
You know, we talked about the fact she hasn't had a seizure since May 22nd, so overall a lot more stable. Julie was having them about every 5 weeks, so it's been close to 2 months now.
Not having the seizures, I think my whole family feels like they can breathe a little easier.
Still, Mark admits Julie's recovery is like a journey, and hyperbaric is just part of their hope for a full recovery.
I mean, Julie is on a path, is the way I'd look at this. And the path doesn't necessarily have any guarantees for us, but there's also no real end to the path after hyperbaric. I mean, there's other therapy we can look at. We've talked about stem cell procedures, which right now are not done in this country, but done in Germany and Japan.
The McNamees are hopeful enough with the treatment that this week they're back in Rockford, and Julie is going through 10 more dives.
The healing process has started.
Her last dive is on their 29th wedding anniversary, and beforehand, Julie, Mark, and the kids will celebrate.
We're going to the Cubs game the day before.
And the Cubs win as Jeff...
No insult to Cubs fans, but I'm betting on a celebration for Julie this season. Maureen McFadden, News Center 16.
And Julie is also betting her outcome will be better than a traditional Chicago Cubs season. Since it can take months for the full effects of hyperbaric therapy to show results, Maureen will check back in with the McNamees in a few months to see how Julie and the rest of the family are doing. And if you'd like more information on the Rockford Hyperbaric Healing Center, we have a link on the big red bar. And we should add that this treatment is still under study. There are varying opinions on how helpful it is.
Since this treatment, we've seen a lot of changes.
This has been the only thing that has actually made a difference.
But every time he would do treatments, there was no question that he improved.
tremendously.
Best known for treating deep-sea divers suffering from the bends, hyperbaric oxygen therapy offers many other important medical uses and is a safe, non-invasive, and effective treatment enabling the body's natural healing process. Hyperbaric oxygen therapy is administered in high pressurized chambers where a patient breathes 100% oxygen while the pressure of the chamber is slowly increased above atmospheric pressure.
It's coming into the back of the chamber, coming down through the sides here, actually coming out through those two white tubular areas there, and it's vented out right there at the bottom.
Hyperbaric Services of the Palm Beaches is the leading provider of hyperbaric oxygen therapy in South Florida, and the center is the first independent freestanding facility in Palm Beach County. Located on the grounds of Delray Medical Center, Hyperbaric Services of the Palm Beaches features 3 top-of-the-line Seacrest oxygen chambers in a brand-new state-of-the-art facility. Prior to treatment, vital signs are taken and ears are checked. Each hyperbaric session involves 3 phases: compression, treatment time, and decompression. Patients may experience pressure in their ears, similar to what is felt on ascent and descent in an airplane. Treatments range from 60 to 120 minutes.
There's different pressure protocols set up for different types of treatments. Neurologic cases are treated for a shorter period of time and at a lower pressure. They don't need as deep a depth.
Hyperbaric therapy has been proven effective for the treatment of a range of neurological conditions, including multiple sclerosis, stroke, autism, and cerebral palsy.
It's useful for so many conditions that people don't recognize it. The doctors are really a long time getting into it, and it needs to be advertised much more. Patients have to speak up and show how well they've benefited from the course.
I have tried everything. Nutritional healing, acupuncture, all sorts of traditional therapies, physical therapy, I could go on, and this has been the only thing that has actually made a difference in my symptoms.
Michelle Snyderman was diagnosed with multiple sclerosis in 1996. MS is a chronic, recurrent, and progressive illness associated with lesions of the nervous system and is now believed to be an inflammatory disease. During an MS flare-up, the oxygen needed to reduce the swelling cannot reach the affected areas. During HBOT therapy, the blood vessels return to normal size and therefore reduce the swelling.
I would say if I could choose between my medication and the hyperbaric oxygen treatments, I would definitely go with hyperbaric because it seems to keep me, not only does it keep me stable, but it actually increases my energy, increases my mobility.
See, look, that's his happy sound. He's stoked to be going in.
Alex was born in 1996, a normal, healthy baby. At 6 weeks, he developed reflux that went undiagnosed by his doctor. As a result, he suffered 45% brain damage, microencephaly, and semi-paralysis.
The doctor said that he would never be able to talk, walk, or recognize his parents.
After beginning hyperbaric treatments 2 years ago, Alex has surpassed those early expectations.
Alex has been able to run, walk, jump. He does everything. He talks back. He's a growing boy. Alex went 6 years without seizures, and we still keep up with this therapy. He also reads on a second grade level, and he does math on a second grade level. So he's pretty much in par with most kids. Verbally, we still have to work on him. Did you have fun? Yeah, you love it, huh?
A stroke is a sudden bleed or blockage to the brain which produces tissue death because the brain cells are deprived of oxygen. The goal of hyperbaric oxygen therapy is to get as much oxygen into the brain as possible. The treatment helps revive the brain tissue that was damaged.
How are you feeling today?
I'm feeling fine.
Walter had a stroke in January of 2008. He was in a wheelchair and walked with assistance. After 20 hyperbaric treatments, he is on the road to recovery.
His voice is better, more strength to it, and his appetite. He's eating good again. He walks better. He walks longer distances.
See ya.
Today, 1 in 150 children are being diagnosed with autism. Autism is a developmental disorder which is characterized by difficulties in verbal and nonverbal communication, social interactions, and unusual repetitive or severely limited activities and interests.
Marco was 7, and he had no receptive language, and he had no verbal language whatsoever, and he was just a hyper little maniac. But once he went in that chamber, he just absolutely loved the oxygen. It was very calming, and so he just made a beeline right in there every time we came. So after 50 treatments, he broke through with a little bit of language.
After 140 treatments, Marco has made tremendous strides.
The hyperactivity was the biggest thing that we used to see before, but now as he's gotten older, I'm seeing just more auditory processing, which is his biggest issue. Understanding the language better, being able to, speak better with some articulation. What else did you do?
Puzzle.
Oh, you did a puzzle? Okay.
Computer.
And the computer?
Hyperbaric oxygen therapy for children with autism and neurological dysfunction can revive the idling neurons in the brain.
That's one of the amazing things about this therapy, that I don't know if there's anything else you could do to get those idling neurons going. The hyperbaric is really very potent as far as that's concerned.
The benefits of hyperbaric oxygen therapy are not limited to these neurological conditions. This groundbreaking therapy has also been proven successful in treating other disorders, ranging from wound care to sports medicine and anti-aging. For many patients facing challenging conditions with little hope, oxygen therapy and hyperbaric services of the Palm Beaches are united to breathe new life into recovery.